World Liver Day is observed every year on April 19th to raise awareness about liver conditions and promote good health. It's not surprising to know that millions of people are affected with liver disorder every year in our country, and therefore it's time to act and raise awareness about this vital organ. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So joining our discussion today, we have with us Dr. Dharmesh Kapoor, Senior Consultant Hepatologist from Yashoda Hospitals, Secunderabad. Welcome to the program, Doctor.
Thank you.
Liver disease are a growing concern in India, and according to recent statistics, about 20 lakh people are affected with liver disease. To begin with, what is the burden of liver disease in our country, Doctor?
So that's a wonderful question, and I think the data that we have on the prevalence of liver disease in our country is far from accurate. The data even in the Western world, falls short of what you actually see as the burden of the problem. So I think to put an exact figure on the prevalence of liver disease for our country might not be possible. However, some facts stand out. The liver diseases are on the rise. As per the Global Burden of Disease WHO initiative, liver disease now ranks in the top 10 causes of any illness producing morbidity, mortality, disability, associated life years and quality of life issues amongst the global population. So that itself is a huge number.
So as there is significant rise of liver disease, what are the various diseases which are commonly seen, and what are the causes for these leading numbers?
So I think the achievement of medical science in the last few decades has been to be able to overcome the scourge of the viral hepatitis. So in this, hepatitis B is something that we've been able to treat with very effective drugs. They are very easily available and quite affordable. So these two viral hepatitis used to be the commonest cause of liver disease up until a decade ago. Now the disease which is taking our peace away is called the MASLD, which is metabolic dysfunction associated steatotic liver disease. Very fanciful name, but many of those in the audience who follow what we say would remember this as NAFLD or NASH, non-alcoholic fatty liver disease or non-alcoholic steatohepatitis. So basically this is a disorder which has got various colors to it. So there is a genetic component, there is a lifestyle component, and of course there is a huge component of diet and weight in this particular disease. So this is a metabolic aberration in which the liver also gets affected, but then it also affects other parts of the body, including the cardiovascular system, the kidneys, produces sleep disorders like obstructive sleep apnea, and has got a very remarkable association with not just liver cancer, but also extrahepatic malignancies. So this is one disease in which there has been a huge rush of research as well as pharmacotherapy in recent times, though the standard of care has still not become available to us in a very granular manner, but some new molecules have hit the pipeline and they have been tried in various stages of clinical trials or used for the common patient. Now this is one particular disease whose zenith we still haven't seen. It is believed that about a third of the global population has got some amount of fat in the liver which is clinically relevant. And by the way, if your liver cells are infested with more than 5% triglycerides, you call it fatty liver. However, more important is when fatty liver is also associated with scar tissue, and this is the syndrome that we call as NAFLD-NASH or MASLD-MASH. The other fascinating thing about this entity is its association with liver cancer. So like I mentioned that the viral hepatitis have been on the decline, but the cancer related to MASLD has been on an upswing. And again, we've not seen the zenith of this, and it's believed that this peak would be seen anytime between 2030 to 2035. However, the fascinating thing about MASLD is that you can develop these liver observations even in the absence of cirrhosis. And that is why this particular condition is very challenging for us physicians.
So I think that was some in-depth discussion about various liver diseases. So with recent advanced technology, what are some recent advancements that we have witnessed in liver care?
So I think the researchers have been creating a beeline for pharmacotherapy for MASLD, but unfortunately, no good therapy has seen the light of the day. Only a few weeks ago, a new drug, which is a thyroid hormone beta receptor agonist, has been licensed by the Food and Drug Administration of the USA. This drug is called resmetirom. But a host of other drugs have been tried. Some of them act on the fat component, some of them act on the inflammation component, and some of them act on the fibrosis component of this MASLD syndrome. However, a comprehensive therapy still eludes us. In our own center, we have been doing research and clinical studies on new drugs, again directed at treating this condition. However, the most important paradigm for treatment of this condition is that you should have weight loss happening on the sidelines. So whenever there will be a decline in the weight, there would be a decrement in the fat in the liver as well as inflammation and scar tissue. The other aspect of achievements in treatment of liver disease is how we have been handling patients who present with what is called as a high acuity liver failure. So these are the patients who present with liver failure. That means they have got organ dysfunction which is confined not just to the liver failure but also extrahepatic organ failures. And this particular syndrome, which is very, very interesting for us, is called acute on chronic liver failure. Our center has a huge uptake of these patients, and these patients are managed in the liver intensive care, and there have been significant advances in the management of these patients.
So in this despair and hope for challenges posed by liver disorder, where does liver transplantation stand in our country, doctor?
So I think in recent times, we as well as other mature liver transplant programs have been transplanting more and more patients of the kinds that I just described in the answer to your previous question, which is patients with acute on chronic liver failure. So earlier, the transplants were being done for patients who had advanced decompensated liver disease, but now more and more patients whom we are transplanting, they are actually not present on the floors or they are coming from the community, but they are being shifted to the operating rooms from the liver intensive cares. So this is the transplant for acute on chronic liver failure patients with advanced hepatic and extrahepatic organ failure. So these patients have got a very nuanced kind of a protocol for management. The organ quality has to be good. The operating times have to come down significantly, because we know that greater the operating time, more the requirements of blood products, and greater the chance that these patients would have some kind of a septic complication in the post-operative period. So these are all new things which we are trying to handle, and I think in recent times, because the experience with this particular indication of transplant is growing, the outcome measures for these patients are also improving. The post-operative care of these patients also are very challenging, because quite a few of them, unlike the acute liver failures whom we transplant, have got comorbidities, and these are in the form of older age, diabetes, metabolic syndrome, and some degree of kidney dysfunction going into transplant. So we need to have a very judicious knowledge of immunosuppression to tide them through the early phase of transplant. So I think these are very, very exciting times for liver transplantation for these high melders or high acuity patients.
So before we wrap this episode, doctor, on the occasion of World Liver Day, what message you would like to share with the audience out there?
World Liver Day, which is 19th of April every year, we all have to, be more resolute in our motto, which is healthy liver, healthy me. And that particular message should echo in the community too. So all of us need to be aware of what we are eating. We have to be very careful with the amount of alcohol that goes into the system. And for us liver physicians, when our patients actually at times ask us how much of amount of alcohol is safe, the answer should be no amount of alcohol is safe. And then the disorders of lifestyle, there should be an awareness for that. Like I mentioned about MASLD in some detail, and we know an extremely effective vaccination exists for the hepatitis B virus. So we would want every single person in the community, whether or not they have any kind of liver disease, to be vaccinated. This vaccination is very cheap and extremely effective. Then of course, anybody who you think might be having a high risk behavior. So these are patients who might be having some issues with their recreational drugs, IV drug abuse, or those who are not so fortunate and need to go into the hospital system for one reason or the other, like the thalassemics, patients who are on hemodialysis, So a word of caution for them that they should be vaccinated and they should keep checking their antibody titers from time to time. So like I've always said, the preventive medicine is far better than anything else that we practice, and the emphasis on this World Liver Day should also echo the same sentiments.
So thank you, Doctor. It was wonderful having you here on the program today.
Thank you.
So this brings us to the end of this episode. Remember, prevention is always better than cure, and getting regularly screened is very important. Stay informed and make informed decisions about your health. And do join us for next week as well. Until then, take care and stay healthy. Thank you.